Hi, my name is Dr. Taylor Krupp, and I am an associate veterinarian here at Central Providence Veterinary Hospital. My assistant Bailey and I are going to talk with you about anesthesia and your dogs today.
Dr. Krupp, is anesthesia safe for my dog?
Overall, anesthesia is a very safe procedure for most pets to go under, but there are risks involved.
What types of procedures would anesthesia for my dog be used for?
Anesthesia is used for a wide variety of procedures that we can't do with your pet awake. So things like your typical spay and neuter when your pet's younger. We can also do things like dental cleanings, dental extractions, mass removals, foreign body removals, all under anesthesia.
Are there dog anesthesia side effects that I need to be aware of?
Yes, so like I said, in general, anesthesia is very safe, but we use several different medications to get to the anesthetic stage. So things like allergic reactions are always a possibility. We try really hard to make sure that we know your pet's metabolic state and if any disease processes prior to anesthesia. But if there is a disease process such as heart disease or a clotting disorder that we don't know about prior to anesthesia, it can make those processes worse. While your pet is under anesthesia, things like low blood pressure, loss of temperature can also be profound. So that's something that your surgical team will monitor very closely. We monitor their temperature, blood pressure, heart rate, respiratory rate throughout the entire procedure and even after.
Are there certain dogs that should not go under anesthesia?
There are certain dogs where anesthesia may be a little bit more risky, so it's important to weigh the risk versus benefits and see if it is something you guys still want to move forward with. So some disease processes like kidney disease and heart disease can make anesthesia more risky. There are things that we can put into place. There's things we can change in the drug protocol and monitoring to try to make it as safe as possible. And so it's important that we just know those risks in advance. And then some breed-specific changes can also play a role. So our brachycephalic or kind of short-nosed dogs have a higher risk of regurgitating under anesthesia, which can lead to aspiration pneumonia. These breeds also are a little bit more prone to having trouble breathing when they wake up, if they wake up in more of a anxious state. So it's something that we have different protocols put in place to help mitigate these risks, and it's important that they get what they need. And then our really small breed dogs have a tendency to lose more temperature and lose it quickly. So monitoring temperature and having different protocols in place to help raise their temperature and keep them warm are really important before, during, and also after the procedure.
What are some possible complications of anesthesia that my dog could experience?
Like drug reactions and like allergic reactions to the medications that we use. You can see low blood pressure, low body temperature. Those are all things that we watch for and can intervene when they happen. And then if we do, like I said, we do everything we can to make sure we know your pet's metabolic health. But if we aren't able to see something prior to the procedure, and then the anesthetic procedure can make it worse. So in worst case scenario, cardiac arrest or clot formation that can go to different places of their body. Luckily, it is very rare, but it is a risk and it's something that we have to monitor for.
What can be done to reduce the risks associated with anesthesia for dogs?
Yeah, so having a really good physical exam, especially the morning of the procedure, is vital to a good anesthetic procedure. And then pre-op lab work to look for metabolic conditions prior to making a drug protocol is important. It is also important that your pet is fasted prior to the procedure so that their stomach is empty before they are induced.
What does the process for dog anesthesia recovery look like?
So the process really starts right as the dog's inhalant anesthetic gas is turned off. The goal is that they wake up very slowly and smoothly. There are times where a pet may wake up in more of an anxious state, and we will often intervene with an additional mild sedative to help them relax and slowly wake up. We will continue to monitor their mental alertness and their body temperature throughout recovery so we can intervene if needed. And then at home, they really need to be in a calm, warm, relaxed area where you can monitor them, but they are not in an area that's chaotic and there's a lot of noise and activity going on.
If my dog is acting weird after anesthesia, what should I do?
Probably depends on what weird means in your case. If they are just more groggy or even a little bit restless or a little more vocal than normal, all of that can be just secondary to anesthesia and they just need time and space to recover. If your pet is vomiting, having diarrhea, having any trouble breathing, or not being able to stay awake when you're trying to interact with them, that's something that I would contact your surgical team about and see if they need to intervene with anything else.
How long does it take for anesthesia to wear off in dogs?
The gas itself wears off fairly quickly. Some of the other medications we use to help them fall asleep and to help with pain control can last anywhere from 6 to 8, even 12 hours. So it depends on what protocol your veterinarian uses. They should be back to normal the next day though.
What should I do if my dog refuses to eat or drink after anesthesia?
Don't force it. Give them time and make sure your surgical team knows what's going on with your pet at home. It can be normal for them not to want to eat or drink that night after anesthesia, but they really should go back to normal that next day. Using anti-nausea medications prior to drugs can be helpful in recovery. And keep in mind that they're probably getting intravenous fluids during their procedure, so they may just not need as much hydration that day. That is all the questions we have so far, and thank you.